Being able to perform first aid can be a lifesaver and is a great skill to learn. The key to being a confident and competent first aider is to attend a recognised first aid course, where you'll be given plenty of opportunity to practice the skills you're taught.
In my experience, most people, probably every person at some point in their life is going to be able to save someone's life. It may simply be that they turn someone into the recovery position. If you don't realise how crucial that is, you wouldn't realise you've saved someone's life. Whether it's the drunk teenager who's had too much to drink and who would die in the night by inhaling their own vomit, someone who falls down, bangs their head. There's just so many reasons why people can get into very close life and death situations. And if you know what to do, you can make a dramatic difference.
I want to be able to have those skills to help my family, at least, if something happened to them.
Burns, scalds, they're the same things, they're just caused perhaps in slightly different ways, and treatment for those is simple. If you don't cool it quickly, it's going to get worse. So lots of running water, cool it down, and when it's cool, cover it so that the air doesn't get into it. Air carries bacteria. So sterile dressings are effective, but they tend to stick. So something non-sticky like cling film is a fabulous way to cover a burn.
I feel a lot more confident now about situations that I might come across, and if I can help, then I will.
When people lose large amounts of blood, it becomes life-threatening, and it becomes so very quickly. So as a first aider, my priority is always to reduce effectively the amount of blood that's lost. We use two techniques. We apply pressure and we elevate. Hold the bleed above the level of the heart and apply pressure. But if you've looked at it and decided it's deep, it's big, it looks nasty, take it to hospital. Don't take any chances. They're the experts.
When you see someone in distress, you just automatically want to help. But it's whether you have the right skills, the right knowledge, the right information to actually utilise that in the correct way to help someone rather than cause them to become any worse. But knowing that you have done a course that's taught you and given you that knowledge and education and practical skills, you can actually apply it.
Choking is considered by us a major emergency because within minutes that person could be unconscious and unable to breathe for themselves. So if we can move that object quickly, we may be able to get them breathing again. Back blow is where we would begin, and it's an effective way, in most cases, of actually knocking the object out of the mouth. Get them to lean forwards, support them so that you don't knock them over, and use the heel of your hand to hit between the shoulder blades firmly. If that doesn't work, repeat it 5 times. If that still doesn't work, then we can move on to that dramatic thing you've seen in the movies, the abdominal thrust. Use your fist just above the belly button, and with 2 hands pull sharply up and back. It's going to blow out air out of the lungs very quickly, hopefully dislodging the object.
Hello, can you hear me? Hello?
Resuscitation is the only effective way we have of getting oxygen to the brain. If the brain's dead, then the rest of the person goes. We always start this by applying 30 chest compressions. We're literally aiming for the centre of the chest. We're roughly over the heart, it's close enough. But we always want the chest to go down by 1/3. So on an adult, you're going to need to use your body weight. And you're going to use 2 hands. Now I would put 1 hand in the middle, place my other hand on the top, pull my fingers up out of the way, and you're going to use your body weight to take this down. These dummies have clicks, so we know when they've gone down far enough. And that's 30 times at approximately twice every second. So it's quite quick, and it's quite strenuous. That's helping to push blood around the body. Then we're going to try and get 2 breaths of air in, plenty of oxygen in your out breath, and blow. And then you repeat it. And as you can see, the chest rises When it's gone back down, we're ready to give that second breath. And you're going to keep on going with that until there's a dramatic change. The skills themselves are very easy to acquire and very easy to put in practice. But the difference between having practiced it and having read it in theory is dramatic. Because in a real life situation, you don't remember what's in the book. You are a lot more likely to remember what you've actually practiced. That's the difference.
For more information, visit www.nhs.uk.